Hello everyone, welcome back with another video lecture on veterinary parasitology. In this lecture, I'm gonna discuss canine heartworm infection or Dirofiariasis. First, I will highlight the causal agent and its morphological features. Then I will discuss the life cycle, pathogenesis and clinical sign of the disease. Finally, I will highlight the diagnosis and treatment of canine heartworm infection or Dirofiariasis. Follow my channel's playlist to get more video lecture on veterinary parasitology. Stay connected with the channel VetMed Lectures to get more video lecture on different subjects of veterinary medicine. So, without further ado, let's get started. Causal agent of canine heartworm infection or Dirofiariasis. Under the superfamily Filariidae, one of the important genera is Dirofilaria. Canine heartworm or Dirofilariasis is caused by Dirofilaria immitis. Final host of these parasites are dogs, cats, foxes, and wolves. This parasite is also recorded in other animals such as horses, sea lions, seals, and black bears. Mosquitoes such as Culex, Aedes, Anopheles species act as the intermediate host for this parasite. This parasite is located in the cardiovascular system of the final host. The adults are most commonly found in the right ventricle, right atrium of the heart, and pulmonary artery. The parasite is called heartworm because of its location in the heart. It can also be found in other parts of the body. The immature stages will be found in the peripheral circulation. The infection is distributed in many tropical and subtropical countries and some temperate regions of the world. Morphological features of Dirofilaria immitis. The adult parasite is long, slender, white-gray in color, and around 20 to 30 cm in long. The length of the adult female is almost double the size of the male parasite. The length of the immature parasite is around 1 to 5 cm. Microscopically, the distal end of the tail of the male parasite is a spirally coiled, which is similar to the features of other common filariids. There are usually 5 pairs of ovoid papillae. The tip of the left spicule is pointed, whereas the tip of the right spicule is blunt. Vulva of the female is located just behind the end of the esophagus. Life cycle of Dirofilaria immitis. Life cycle is indirect. The final host of this parasite are dogs, cats, different other carnivores that I have already discussed. Adult parasite is located in the heart. Intermediate hosts are different species of mosquitoes. L3 is the infective stage which will be developed in the mosquitoes. So the adult female are ovoviviparous and lay L1, that is microfilary in circulation. It is important to note that microfilary can be found in blood at all times, but there is a tendency to periodicity. This periodicity appears to vary in different countries. Then L1 enters into the gut of the mosquitoes when they suck blood from an infected host. L1 to L3 develops in the body of the mosquitoes. It takes around 2 to 3 weeks depending on the optimum temperature. Afterwards, this L3 is released to a new host or on the same host during blood feeding on it. Over the next few months, L3 then migrate to the subcutaneous or subserosal tissues and moves to L5. Only the L5 pass to the heart via the venous circulation and become adult. The prepatent period for this parasite varies from 6 to 9 months, but it takes around that is minimum 6 months. Remember that adult worm can survive 5 to 7 years, but the microfilariae may stay viable after 2 years. Pathogenesis of canine heartworm infection or dirofilariasis. In majority of the infected dogs with few worms show no sign of illness. In heavy infection, circulatory distress, valvular endocarditis, congestive heart failure, pulmonary embolism, etc. are developed, which threatens the life of the affected dog. If the adult parasite block the vena cava, it results mechanical interference and phlebitis, which are associated with circulatory distress. Lodgement of the parasite or parasitic mass in the posterior vena cava leads to an acute or fatal syndrome known as vena cava syndrome. It is characterized by liver failure, hemolysis, hemoglobinuria, hemoglobinemia, jaundice, and death of the animal within 2 to 3 days. Next, worm in the right atrium of the heart cause endocarditis, leading to the damage of the tricuspid valves. If the pulmonary artery is partially obstructed by the worms, it leads to the right-sided congestive heart failure. As a result, edema and ascites are developed. Partial obstruction of the pulmonary artery also causes pulmonary hypertension, leading to compensatory right ventricular hypertrophy, because the ventricular wall needs to work more to pump the blood to the artery. Stenosis due to the damage of the artery further enhances the pulmonary hypertension and ultimately contributes to the congestive heart failure. Damage of the arterial wall due to endarteritis, there is formation of thromboemboli. The consequence is very fatal if a single end artery such as coronary artery is blocked. In that case, animal will die due to myocardial infarction. Endarteritis along with deposition of parasitic mass in the artery will lead to dilatation of arterial wall known as aneurysm. If artery ruptures, it causes hemolysis and exsanguination resulting death of the affected dog. The dead and dying worms and their fragments lodge in different organs of the body. If these things are carried to the kidney, it causes glomerulonephritis. It is possibly due to deposition of immune complexes. If these things reach to lungs, it will result granulomatous reactions and a small granuloma will be formed. Little or no damage is observed if microfilaria present in circulation. If they die and lost to various organs may result in small granuloma formation due to granulomatous inflammation. Microfilariae are also known to cause dermatitis and ocular infection. Please note that with the larvae of Dirofilaria, Wolbachia or rickettsial organisms stay as endosymbiont. Therefore, Wolbachia species have also been implicated as a component in the pathogenesis of this disease. Clinical sign of canine heartworm infection or Dirofilariasis. In heavy infections, dog become listless, exercise intolerant, and gradual loss of condition. Later, there is soft chronic cough with hemoptysis. Dyspnea, weakness, cardiac enlargement, hepatomegaly, edema, and ascites are also observed during later stages of this disease. In acute vena cava syndrome, which is characterized by hemoglobinuria, icterus, and death of the animal within 2 to 3 days. In lightly infected dogs, poor performance during periods of sustained exercise is observed. Diagnosis of canine heartworm infection or Dirofiariasis. The disease can be diagnosed based on the clinical signs that I have already discussed. Radiography may reveal the thickening of the pulmonary artery. Angiography may also be used to demonstrate more vascular changes. The simplest way to diagnose this infection is to examine the blood smears. Just take a drop of fresh blood on a glass slide and put a cover glass on it and directly observe under a microscope. Wriggling movement or active movement can be visible in positive cases. Further, a thin blood smear with 10% Giemsa staining can also confirm the positive case. A thick blood smear can also be done in case of subclinical infection or suspecting a lower number of microvilli in circulation. Thick blood films made from the marginal ear vein may give the best results. In addition to the examination of blood smears, the modified knot techniques can also be performed for the differential diagnosis of microfilaria of Dirofilaria immitis and Dipatalonema reconditum. For performing the modified knot techniques, take 1 ml of blood with 9 ml of 2% formalin. Afterwards, centrifuge it at 1500 rpm for 5 minutes. Discard the supernatant and examine the sediment after staining with 0.1% methylene blue. In positive cases, the microfilaria of Dirofilaria appeared as slightly curved body with tapered anterior and straight posterior end. On the other hand, the microfilaria of Dipatalonema has a straight body with blunt anterior end with a button hook-like posterior end. Micropore filter techniques can also be used. In this case, 1 ml of blood in sodium citrate or other anticoagulants is first lysed with 0.1% sodium carbonate or so. Then the blood is passed through a filter with a 3 micrometer porosity. The filtrate is then stained with 0.1% methylene blue and examined under a microscope. Examination of buffy coat can also be tried for the detection of microfilaria. Antigen detection ELISA can identify the mature worm antigen but not the microfilaria. It is noted that the microfilaria may not be detected in 5 to 20% of Dirofilaria infected dogs. Therefore, clinical history, clinical sign, and thoracic radiograph along with electrocardiography are recommended. Treatment of canine heartworm infection or Dirofilariasis. Treatment of Dirofilariasis is very tricky. Before treatment, physical examination of the dog, including the function of heart, liver, kidney, and lungs must be assessed because this will ultimately affect the prognosis of the disease. Infected dogs are first treated with an adulticide anthelmintic, 6 weeks later a microfilaricidal anthelmintics, and then the dog should be placed on prophylactic medication. The most common adulticide used in canine heartworm infection is melarsomin and thiacetazimide. Thiacetazimide is a potential nephrotoxic and hepatotoxic. Treatment should be stopped if signs of toxicity such as persistent vomiting, anorexia, icterus, etc. appear. The American Heartworm Society recommends the use of doxycycline and macrocyclic lactones prior to use of melarsomin. The reason behind is that doxycycline will kill the Wolbachia which stay with Dirofilaria as an endosymbiont. The macrocyclic lactones will kill the immature microfilari in the circulation. You may follow the guidelines of the American Heartworm Society. Remember, all kind of exercise and stress for the dog should be avoided during the treatment and week after. Microfilaricidal drugs such as dithiazine, levamisole, and macrocyclic lactones such as ivermectin can be suggested. In endemic areas, dogs should be under preventive medication. These are the reference material that I have used for the preparation of this presentation. Thank you so much for watching this video. If you have any question, please put it in the comment section below. I'll be happy to answer. Good luck for your study, and I'll catch you in the next video lesson.